Shalom Aleichem. We're on page 275, Rabotai. 275. Well, just to make us feel a little bit good, just so you should know, this is Shir number 67. Since we started Hilchot Shabbat, this is the 67th Shir. Hashem give us many more Shirim to go through. We are starting a new world in Hilchot Shabbat right now. We're starting the world of Hilchot Refuah. Medicine, saving, doing things on Shabbat. Today is pretty much an introduction into the laws of Refuah and getting into the topic of Pekuach Nefesh and what constitutes a Pekuach Nefesh. But let us start in the introduction on page 275. We know that Shabbat is not one of the big three, meaning we have three. Right, you got to let yourself be killed and don't do it. Which are those? So Reb Tzion said very quickly about the Zara, Shichas Damim, and Arayot. Okay, so you have the. Oh, okay, I'm sorry. So improper relationships, about the Zara, and murder. You have to give up your life, but not for Shabbat. This we know. Now, if I would tell you, choose a Gemara that talks about Hilchot of Refuah b'Shabbat, which Masechet would you tell me you would find it in? Is it in Masechet Shabbat? It is not found in Masechet Shabbat. In fact, the Gemaras that talk about Refuah b'Shabbat, it is found in Masechet Yoma, in Masechet Menachot, and Masechet Avodah Zarah. Nothing in Masechet Shabbat. They tell us a very important insight, first of all, just to start off the bat, that you cannot, you have to learn all of Shas to know all the halachot. You cannot say, I'm going to learn just Masechet Shabbat. Masechet Shabbat doesn't even talk about Hilchot of Shabbat. So we're going to start off in the Masechet Yoma. It is on Pei Hey Amud Aleph.
I tell you why. Because in their time, there was not like today refuah all over.
So why in Gemara? Why in Yoma is it there?
They had to ground it, and everybody knew.
We're not just talking about making medicine. We're talking about the practice of medicine.
Everybody knew there is no allowed to ground refuah in Shabbat. It was like
I don't know. That's not what our Chachamim say. Our Chachamim say that Dafka made this way. That Dafka, the Chachamim didn't put all the halachot of one topic in that Masechet. Because this way you have to learn all of Shas to understand all, because all the Torah is related to each other. You have to learn all of it. So we're starting Masechet Yoma Pei Hey Amud Aleph. Source number 1. There is a story. Uchvar Hayar Bishmol Rabbi Akiva Rabbi Elazar ben Azariah Mahalichin Baderech. Rabbi Yishmael Rabbi Akiva Rabbi Elazar were going on the road. The Levi Hasadar Rabbi Shmuel ben Osher Rabbi Elazar ben Azariah Mahalichin Acharein. And Levi Hasadar and Rabbi Shmuel, the son of Rabbi Elazar ben Azariah, were following behind. Nishala she'ela zo bifnehem. And they asked them this question. What was the question? Minayin the pekuach nefesh shedoche et hashabbat. From where do we know that for pekuach nefesh, someone who is very sick, we're on page 275. Someone who's very sick, then he could be doche et hashabbat. Now, Rabbi Chaim says chai behem. But the Gemara actually goes through 5, 6 different sources. And the last two is brought here in the Tzurba. The last two is brought here on page 275. And we have Rabbi Shimon. That's the second to last opinion in the Gemara. Rabbi Shimon ben Manasseh Omer. Oh, you know how you're allowed to break Shabbat in order to save someone who's sick? V'shameru v'nei Yisrael et hashabbat. Amra Torah, halel alav Shabbat ahad, kedei shishmor Shabbatot harbe. Break Shabbat once, so this way he can keep many more Shabbatot. Now, the truth is, this is not what we're holding. Right. Why don't we hold this? Because what is this saying? This is saying only save the guy if he's viable for another Shabbat. What about if you're going to save him for 2-3 days? So, I shouldn't do it on Shabbat. That's what it seems to be. What? You're predicting based on what we know that these guys, you save him 2-3 days. What do you mean goizes? How do you know he's actually going to die? At some point, you're right, 100%. And still, there is a point in halachic. We would have to make a decision that this person is considered a goner. He has a day, he has 2, whatever it is. So can you save him? And based on this verse, which we wanted to use, that says only save him if he's going to keep more Shabbatot. We don't pass it this way.
The second one is what I said.
Now, the second one that brought here, and the final one in the Gemara, Amar Rav Yehuda, Amar Shmuel. Had I been there, I would have said this source that is better than all of their sources. So Rabbi Yehuda bar Shmuel, he says, I got the best source. What's the source? So we're going to read the entire pasuk. The entire pasuk reads as follows: Ushmartem et chukotai. You should guard my commandments, my decrees. Ve'et mishpatai, my commandments. Asher yaseh otam ha'adam, that a person should do them. V'chai bahem ani amunai. I am Hashem. So it says he should live with the commandments. So says the Gemara, v'chai bahem lo sheyamut bahem. You should not die with them. And this is the source that the Gemara ends off with, and says the Gemara actually even a little more. Amarava lechulu itla pircha bar midishmuel delayed le pircha. All the other ones you can find a problem with it. All the other opinions that the Gemara brought, like 6 opinions of where you learn it from, but except for this one of Amar Yehuda Amar Shmuel, where Chai Bahem, you can't ask any questions on them. It says the Gemara a little bit further. Says the Gemara, the truth is all those other psukim. We're on page 276. All this other psukim, v'chulu ashkechon vadai. They're just teaching us if you for sure can save him, then you have a right to save him. Safek Monolon, where we learn if it's a Safek Pekuach Nefesh. Maybe he's Pekuach Nefesh, maybe he's not Pekuach Nefesh. How do I know I can save him? There's certainly no refutation. From this pasuk of V'chai Bahem tells you, even if it's a Safek Nefashot, you should still do what you can do to save this guy. And in fact, the Ramban in the Sefer Torah Adam, the Ramban, Nachmanides, says, what about a fetus in the mother's womb before 40 days? What is it considered? Just water. Nothing. Says the Ramban, can you save this fetus?
No.
Save it. The mother is in danger. And the mother's not. The mother's fine. The baby's in danger. The fetus is in danger. Whatever the story is. The fetus is, the mother's fine. The mother's fine. The fetus is in danger. The fetus is not even 40 days old yet.
How he knows? How Rabbi Nachmani knows the fetus is in?
He's giving you a case.
In 40 days, before 40 days, the fetus is in danger.
Whatever the story is.
What do you mean? Today they don't know.
Forget the story, how it happens. The question is as follows. All right? The baby, it's not even a baby yet. It's a fetus, not 40 days. It's 35 days, okay?
It's not even a person. It's nothing.
Can you even Halal Shabbat to save that fetus, yes or no?
No.
They all saying no, and the halacha is
of course
one may violate Shabbat to save a pregnant woman from having a miscarriage. This is even if the fetus is younger than 40 days old, says the Ramban. Because the Ramban says, you know why? Because what was the last source, second to last source in the Gemara? What says, Shabbat, save them today so they can have more Shabbatot. So says the Ramban, even though the halacha, we don't use that second to last source, but we do use it for some things. Like in this case of the fetus, who's not even 40 days old yet, you're allowed to violate Shabbat, Halal Shabbat, in order to save that fetus. That's a Ramban in Torah Adam. Okay, moving on. It's considered water for some situations, but doesn't make a difference. It's a fetus, and you're allowed to save it so it can keep more Shabbatot. Okay, Mesechet Yomah, Pei Daled Amud Bet, and source number 2. Tanu Rabbanan. Tanu Rabbanan, Mefakechin Pekuach Nefesh b'Shabbat. You're allowed to save a life on Shabbat. V'hazariz harei zeh mishubach. The person who runs to do it, he is praiseworthy. Okay? Why do you think he's saying this? Why does he want to say this? The one who runs to do it.
Wait a second. Shabbat.
Right. There's a lot of people, and I've seen it firsthand. I was in a shul one time, and a guy fainted. Okay? He was in Queens. A guy fainted. He hit himself as he fell down. And people are turning around. Should we call? Should we not call? They turn on the phone. Or maybe give it to the child to call? Sur. You yourself saw that. You take the phone, you dial it. That's why it says over here, and you don't have to go and ask the rabbi, can I call? Okay, the time you do that, big problems. In fact, the Talmud Yerushalmi, listen to the Talmud Yerushalmi in source number 3. The Talmud Yerushalmi says, Tane, Hazariz Mishubach. The guy who runs to do it, Mishubach, he's praiseworthy. Vanish'al Meguna. But the person who is asked, if the person who's asked, I mean, the guy sees it, he walks over to the rabbi. He says, Rabbi, can I call? And when he is considered what? Blameworthy. The rabbi is getting punished for the other person asking him, can I call on Shabbat or do something for it? I have to explain why. Mr. Abba was going to explain in a moment. The person who's asking, the guy who's asking, he's a murderer. You're asking questions, can I save him, can I not save him? You're killing the guy. So take a look at the Mishnah Berurah. Listen to the Mishnah Berurah. Pirush. Oto ha'ish hu mitchased, he's like a chassid, v'yar l'chalel Shabbat b'chola kazeh. He's like, I don't know. Can I not be Mechalel Shabbat? Ki em al yidei mora. I need to sack on this. I need another rabbi to tell me yes, no. Harei hu shofech damid. Shebe'od shehu olech l'shol. Here's how you'll tell me again. Because by the time he goes to ask, more things can happen. You see it? One of the most important things when it comes to medicine is time. Time. Person is sick. The longer you take to get him help, the more problems. You got to go right away. Don't sit around. Therefore it says, Lo tarmod. You cannot stand the damra echa. You cannot stand on the blood of your friend, of your brother. You have to go. And now, Yerushalmi says, the person who gets asked, he's blameworthy. But what did I do? The guy just came to me and asked me, what did I do? You know why? He should have taught the people when it comes to pekuach nefesh, go and do right away. So if they're coming and asking him, it means he didn't do his part by teaching them that pekuach nefesh, you do whatever you need to save them. Okay? So he gets blamed. That's right. You got to join the Tzurba. You got to know these stuff. Right? In the end of the day, the rabbi always gets blamed. So here, again, you're going to get blamed for not teaching. It's part of the job description. Right? In the job description, like right on the top, it said you'll be blamed for everything. You sure you want the job? Okay. Now, says even further the Mishnah Berurah. Maybe the chayil himself, he's very sick. He starts to say, he's getting scared. I don't want him to do, malachot for me. He's on the fence about it. Says Mishnah Berurah, kofin oto. We force him to take the care. He's a v'kuach nefesh. Don't become a hasid now and tell me I don't want to Mechalel Shabbat. Shabbat, everything goes. You got to save you. Umedabarim. I don't know where that question is coming from. Umedabarim alibo shehu hisidut shel shtut. You got to tell him that he's being a chassid shaita right now. If he's trying to avoid life-saving measures because he doesn't want to Mechalel Shabbat, he's being a fool and he'll be punished for that. Because you're supposed to get life-saving measures. And if you're refusing them, person can get punished for that. Now,
how does he know if it's life-saving or not?
Okay, so that we're going to see. That's another Gemara that's going to tell us is it pekuach nefesh or not. Is it the guy really on the? And we're going to see safek, like the Gemara said, safek pekuach nefesh also. Even if you're not 100% sure it's pekuach nefesh, but it's possible it's pekuach nefesh to a degree. That also you have to be mechalel Shabbat for. Okay, don't become machmer. I don't think he's gonna, no. You take care of the guy.
Someone thinks maybe I thought.
So we're going to see. We're gonna get into it. What's pekuach nefesh? If you take a look, on page 278, we're gonna start defining pekuach nefesh. Let's just see where we are right now. Okay, so Amar Rabba says Mesechem Menachot Samech Dal Amar Aleph. Amar Rabba, if they had a chola, all right, they had someone who's sick, and they said, you know what he needs? He needs a fig. He needs to drink a fig, eat a fig. And what happens? 10 people ran. He only needs one fig. 10 people ran to get him the fig. They're all potter. No one was mechalel Shabbat. Even though he only needed one, and 10 people went to get it, each one brought one, each one was mechalel Shabbat, no one is considered mechalel Shabbat. And not only that, and even if someone came first and gave him one, and I didn't know yet, and I went to get him a fig, and by the time I brought it, he was already healed, still I was not mechalel Shabbat. But not only that, Shulchan Aruch adds to that. Listen to what Shulchan Aruch says. Shulchan Aruch in source 7. Shulchan Aruch says, not only they didn't do a Avera and their patur, v'yesh lahem sechar tov me'et Hashem. Not only they didn't do an Avera, not only mechalel Shabbat, each guy who went and tried to save this fellow, even though it wasn't needed, schar tov me'et Hashem. He gets a huge reward from Hashem. Shulchan Aruch is showing us the importance of saving someone's life and being mechalel Shabbat in order to do that. So we'll just take a quick review of this sources in the laws of Shabbat, Rabbi Nachson. He writes over here, outside the Tzurba for a moment, quick review. It is a mitzvah to violate Shabbat and do any melacha that is needed in order to save another Jew's life. It's forbidden to delay. In fact, the more faster you are, the greater the reward will be in Olam Haba for him going that fast to do it. And even if the person who is sick, we'll see this in a moment, he wants to avoid, right? He wants to not do it. He doesn't want Mechal Shabbat. It's a sin for him to do that. We must force him and explain to him that he has to save his life. What happens after the fact? I thought this guy was dying. I rushed him to the hospital. I went through all the lights, says Mechal Shabbat, this, that. We get there and I find out it's only gas pain. Okay, a person who violates Shabbat in order to save someone whom he thought was life-threatening situation is not liable, and in fact he gets the mitzvah instead. So even if you were wrong in the end of the day, but you had valid reason to think he was in danger, mitzvah. Don't feel guilty. You're not mechalel Shabbat, and you got a mitzvah instead. Okay, So that's a very good question. And what Tzurba is asking is it mutter to go and do this? Or does it mean that it just gets pushed off, sort of like the prohibition gets pushed to the side and I'm allowed to do it, but it's not like a hutra? That is a machloket. We're not going to get into it, but if anyone takes a look in note 2 on page 275, there's a well-known debate among the Rishonim. Is it hutra or is it duchya? Nevertheless, it's not entirely clear to the Rishonim what they decided in this.
I think at the end they said kuya.
But from the way the Shulchan Aruch is saying it, it's a mitzvah. I mean, it's like you got to go do it, and it's not just that it's pushed to the side, but it's something else.
I think yeah. Like the bird, say, dial the phone number before. And all you gotta do is
press
the
one.
redial.
Okay, so there's a little difference.
You do as less as possible.
So the question, your real thing you have to do now is define pregnancy. Meaning, is it pekuach nefesh or not? Obviously, what?
Yes.
Is it? Is it?
Absolutely. Either the child or the mother, one of them.
Is it? Is it
Absolutely.
pekuach nefesh that we're going to see that if it can wait till after Shabbat, it's not considered pekuach nefesh? Oh, can it or can it not?
Well, we don't know when the baby is.
So most women, when they go into labor, they have some time.
What do you mean?
You're right, not necessarily everyone.
In the taxi, but in the home.
You're right. But how many of that is that the ruba of the notion that they give birth in the taxi or in the
But this is the one.
What I'm trying to say, it may not be a legit pekuach nefesh to that degree. That's why the poskim are going to tell us when it comes to pregnancy, you want to do things slightly different. You want to prepare beforehand because you also know. Pekuach nefesh is not something I know. I mean, it could be, but most of the time, it's something that happens spontaneously. I'm in trouble right now. Pregnancy is something that I can suspect. I know it's 40 weeks, whatever it is. It's a little bit different. We're not up to pregnancy now. I just want to give you that idea that it plays a little different.
It's not pekuach nefesh because today,
it's not me. It's supposed to say that.
No, today it's not so pekuach, but then on those days.
Oh, okay. It's
you know
a different story.
How many that died? How many babies died?
That's a different story. We say it every Friday night, right? We say it every Friday night in the B'mei Madlikin.
That's what I'm
right. That the ladies can die, exactly. and it was a major thing.
You know, so it could happen also today if the woman she wants to.
Okay, when we get to pregnancy and giving birth, we'll go through the sources at that time. I'm just gonna let you know that it's not viewed that way entirely today. Okay, now, Uriel wanted to know, how do we define pekuach nefesh? It's mine pekuach nefesh. The guy is in danger. I'm not sure.
It's like usually means like
pekuach nefesh. What is the shirish?
Yeah, I don't think it's like pokech ivrim, right? What is pokech? Like a pikech is like a smart person, right? Or clever.
Okay, so how do you translate it to pekuach nefesh?
Not pokech. Pokech. You're saying someone who's open head is all like
You open his soul, meaning his soul is going out. Is that the lashon?
Doesn't pikech mean like a smart person?
It could be pikech.
I think the pekuach nefesh is to guard the nefesh. So the nefesh, that's the chaim. If the nefesh goes out,
we'll ask ChatGPT after the shir. What do you think pekuach nefesh means? Yeah. Okay, Rabbi Zai, give Mishnah in Masechet Yomah. The Mishnah in Masechet Yomah tells us as follows. Let's go through this Mishnah, Rabotay. We're on source number 8. And the Mishnah is found in the Gemara on Daf Pei Gimel. And the Mishnah says, Mi shenafala alav mapolet. Okay? Person, a building collapsed on him. There was poor construction, earthquake, whatever you want. The guy was there, and the building fell on him. Safek husham, safek enosham. We don't even know if he's still there. Meaning with all the rubble going around, he may have escaped. We don't know he's there. He's there, he's not there. Safek hai, safek met. Maybe even if he's there, maybe he's dead. Maybe he's alive, maybe he's dead. We don't know. Safek nochri, safek Yisrael. Maybe he's a guy, maybe he's a Jew. So we'll have to see. Nowadays, really, it wouldn't make a difference. Nowadays, we treat everybody, including the goyim, on Shabbat, because for Eva and other reasons, we treat everybody. But in the days of old, it might have played a little different because you don't michalel Shabbat for reasons you don't have to. You can get the fire department to come to do the rest. Okay, safek nochi, safek Yisrael. You still go for it. So what does it say next? You clear up the debris.
Until you see it.
Mitzah uhu hai mefakihin. If you find him alive, you continue to clear the rubble. Ve'imet yanihuhu. And if he is dead, you leave him there. Okay? Because kavod abrit for the kavod abrios for cover for the body is not something Mechalel Shabbat for. But if the guy's alive, it will be Mechalel Shabbat. Okay? So it comes out, this Mishnah very clearly shows us, for Safek, you'll be Mechalel Shabbat. Safek, I don't know if he's there, I don't know he's alive, he's not. But Safek, Pekuach Nefesh, you're going to be Mechalel Shabbat. doubtful he's alive or not, or he's in danger, you're still going to go and try to save him. Okay. Now the Gemara in Yoma is going to continue its discussion talking about eating on Yom Kippur. But eating on Yom Kippur is also a pekuach nefesh situation. Because the guy, let's say the doctor says he has to eat because otherwise he's going to die, right? So how do we view it? It's a doraita as well, just like Shabbat. So how do we view Yom Kippur? And whatever you do on Yom Kippur regarding eating, we can apply it to Shabbat. All right, it's the same din for Mechalel Shabbat for pekuach nefesh. So we're looking in source number 9. Source number 9. Say again. Yes, but also starving also. Okay. Look at source number 9. Ama Rabbi Yanai. Chole Omer Tzarich. The sick guy, he says, I'm going to need to eat on Yom Kippur. The guy says, I have to eat on Yom Kippur. Verofe Omer Eno Tzarich. And the healer says, we'll use the Lashon doctor. Doctor, not necessarily a healer, but since we use that as the lingo that we use in American English, so we'll say, a doctor says he has to eat. You don't have to eat. Shom'in la hole. We listen to the sick individual. Listen to the guy versus the doctor. Why? Matama lev yodea marat nafsho. The person knows himself better. He knows his own problems. Okay? So, doctor's opinion versus patient's opinion regarding eating on Yom Kippur. We're going to see it's going to be a little different for some other situations where we can listen to the doctor versus the patient. But for eating on Yom Kippur, the guy says, I feel that I'm going to need to eat. Doctor says, you don't have to eat. You listen to the patient. The Gemara says, Pshita. It's simple. Why would I think otherwise? Oh, maybe I would say the doctor knows better. Kamash Milan. No, the person knows better. Okay? Now, this is not always true. Not always true. Next Gemara. Look in source number 9, the second paragraph. The doctor says you have to eat. I don't have to eat. Now what? We listen to the doctor. Wow, what do you mean?
Always
Before I listen to the patient.
Always the
kula is true. Gemara says, this is a very important line. Matama tunbahu dinakitle. Delirium has seized him. He's thinking that he can survive and do this is because he's not thinking straight. All right. So once you can establish that a patient is not thinking straight, then you don't have to listen to the patient, but versus you can listen to the doctor at that point. Okay.
He knows that he's not feeling well. He can't say, I know that I'm feeling well.
Why is that? You always go to the kula. So if the guy, someone says he can't fast, he doesn't have to fast. But I'm learning from this Gemara as well. The Gemara says that Tunba hu denoketle, some sort of confusion got into him. So you can show that confusion has got into him. You don't have to listen to him.
English says he's in denial.
Too much medication.
Yeah. Yeah.
Sunday about 5 o'clock. When nothing coming up, we can walk now. Just like burn. That kept going for 4 days.
Oh wow.
4 days. Every time I go, big thing that when I went to the doctor. Now, what's wrong? Because around my friend doctor. Okay, but the liver did not deliver liquid to your body. Did not deliver.
Wow.
All this liquid. So this is the problem. So yeah, it makes sense. 4 days.
Wow.
Pain.
Yeah. So people can get a little confused, think this is like this is like that. person has to realize that. Now, the Gemara continues, and the Gemara says, what about eating him? He looks better now, for sure. Shkoyach, thank you for asking. Okay, I will tell you. The source number 10. Source number 10 on the page 279. Ma'achilin oto al pi beki'in. We feed him on Yom Kippur based on the experts. Shita, which is obvious. What's the case? What's this case? Safek nefashot hu, safek nefashot lahakel. Of course you listen to him. Safek nefashot. So the expert says feed him, you feed him. Gemara says, listen to this Gemara. Lo tzricha. It's not needed except for this case. The ikat tre acharine behadeh de'amre lo tzarich. There were two doctors with the sick person, the patient, and two doctors who all say, three people are saying, patient and two doctors, he does not need to eat. Okay? And there's one expert doctor that's saying he has to eat. What happens at this point? You give him to eat. So, today, we say usually 2 is like 100, 100 is like 2 when it comes to witnesses. We go with the majority. Oh, but that's umdanan of making assessments. But Indian umdana de memoina. Safek nefashot hu. And safek nefashot will go with the expert doctor, even though he's the minority opinion, versus the patient and two other doctors, and have him eat on Yom Kippur. So it turns out the expert advice takes instead of the patient and the other two doctors. Yeah. So now, I'm going to read to you from Rabbi Nachshon, he explains this very clearly, the three cases here. The doctor says that a person's illness is life-threatening, and the person says his situation is not life-threatening and does not need help. One listens to the doctor. If there are conflicting opinions between doctors, and one doctor says that the illness is life-threatening, and the other doctor says it is not, one should listen to the doctor who says the situation is life-threatening. You have two regular doctors, and one is arguing, one's saying this, one's saying that. Safek nefashot lehakel, you take care of it. If the sick person states that he feels that his situation is life-threatening, even if many doctors say it's not, you listen to the sick person. So, safek nefashot lehakel. That is the theme in all these things. Now, the last case, if there are conflicting opinion between doctors, but one of the doctors is known to be a specialist. One is an expert specialist doctor. Okay? One should listen to the specialist, even if he says it's not life-threatening. You hear that? So usually, listen to that, listen to this doctor, listen to the patient, anyone who says it's life-threatening, you listen to. Except if it's an expert doctor. Expert doctor says not life-threatening, you listen to him. Now, your question is about if he's not Jewish and if he's not religious. Okay, so, okay, let's take a look. You're jumping the gun, I will tell you. Let's take a look. Shulchan Aruch, I will tell you, source number 11. Shulchan Aruch says, Shulchan Aruch is going to go one step further, I will tell you. We've been talking about doctors, we've been talking about the patient. Shulchan Aruch is going to bring another case. Joe Schmo's there. All right? Joe Schmo's there. He's another guy. He's not a doctor. He's not the patient. And he says it's life-threatening. Listen to this guy or not? Let's take a look. All right? Take a look at the Shulchan Aruch. Shulchan Aruch says, even though it is external, Mechalin alav is a Shabbos. You mechal Shabbos. V'mroife echad amitzarech, roife echad amitzarech. Mechalin. Safek nefesh lahakel. V'yesh mi she'omer she'en tzarech mumche. You don't need an expert. You don't need a doctor. The kol bnei adam chashuvim mumchim k'tzas. Everybody's considered somewhat of an expert. Today especially, everyone has Google, right? Everybody has WebMD, right? I'm just joking for a second. Everybody is somewhat of an expert in medicine. Everybody knows, you ever have something and you go around to people and tell them, I have something on my foot. Everybody has an eitzah. Dip it into this, put it into that, do this, do that. Everybody's somewhat of a mumcha. That's what the Shulchan Aruch says. So says the Shulchan Aruch, if somebody thinks, not a doctor, it's not the patient, he says, your life is in danger. Hashem says, your life is in danger. Shabbat. So that's what Shulchan Aruch says.
Don't take a chance.
Now, the Ramah says, the Yesh Omrim Dafka Yisraelim. It's only if it's a Jewish guy who says this. Of a stam any Yehudim, Shein Rofein, and if it's a non-Jew, he has to be a doctor. If he's not a doctor, reason being, what would be the reason of the Ramah? Because a Jew would make this cheshbon. I don't want you to be Mechalel Shabbat, but I really think you're in danger. That's when I'm going to say something. The other guy who has no laws of Shabbat in his head, what's for him to say you're in danger? He's not thinking you're Mechalel Shabbat as a whole, it's a big thing. So he's just going to say everyone's in danger, right? Err on the side of caution. You're in danger, you're in danger, you're in danger. Everybody go to the ER. This way, he has no problems, right? A doctor doesn't know what to do. What is he going to tell you? Go to the hospital. Go to exactly. So he'll tell you, I don't know, you're in danger, you're in danger. But so he has no application of Shabbat halachot. But if Yisrael is going to tell you, as a Jew is going to tell you, someone who's Shomer Torah and mitzvahs, he's going to tell you, I think you're in danger. He's already cheshboning this out in his mind before he's telling you. So let's see. We're right now talking about not a doctor, Eino Mumcha, for the moment. Okay. Now that's what the Mishnah Berurah says. The EMT could be considered mumcha enough for pekuach nefesh. They. That's why I said I don't like using the word roif as being doctor. People just use it as doctor. Roif really means a healer. Anybody who is familiar with what's it called, cases of danger of life, they can tell you. So an ER nurse, right? So an emergency room nurse who's been seeing all types of things coming into the emergency room would be someone I would consider a mumcha. They know what's going on. They actually are trained to triage. One of the things they do in the ED when you come, why sometimes you think you sit there for a very long time, because they do a triage. Triage means they look who really needs to see the doctor the fastest. So you come in because of your sprained thumb, you're going to sit on the side, you'll survive, right? The guy who's coming in with a gunshot in the back of his head or whatever it is, he's going to move in faster. That's called triaging. You got to know your who needs first.
Not a good sign if they give you breath.
If you're giving you precedence, moving you fast. Right, unless you know somebody in the hospital and you move things along, that's okay. But otherwise, so what are we saying over here? That right. So someone is a mumcha. That was the answer for the mumcha. Fine. Says the Mishnah Berurah, since the Jew is commanded regarding Shabbat, nevertheless he said the one must violate. He's certainly relying on somewhat of his expertise, not just saying it. Now the yachin, who's the yachin? Yachin has Yachin and Boaz, right? Those are the two pillars in the Mikdash. There was a gadol, you all know him from the Mishnayot, Tiferet Yisrael. It's a commentary on the Mishnayot. His name was Rav Yisrael Lipschitz. He was born in 1782. You can go through his history over here. Big tzaddik, and he wrote a lot of stuff. And one of the things he wrote was Yachin. And Yachin, he wrote as follows: if a goy doctor tells you that you're going to have a sakana if you fast on Yom Kippur, you may not have to listen to him. He says, because I've seen it, that they're all they're no more reliable, and they say that anything, small illness and fasting can cause a danger. Okay, and I've seen this up until today. Today, a lot of doctors, if you ask them, pregnant women, can they fast on Tisha B'Av? Can they fast on Yom Kippur? The regular doctor, not a religious doctor, is going to tell you, no, can't fast. She's healthy. She's this. No, can't fast. Straight off the bat. So the Yachin says, I've seen this in his days, and this is already in the 1780s, in the 1800s. He's saying they're just saying no one can fast. He said that's not true. They're not reliable. He says they're not reliable. You can't really trust them anymore, basically, he's saying. They're not so reliable. It's just, I guess they all just want to say, be careful, be careful. They're not very reliable. So he says, when it comes to a Goyish doctor, when you ask them questions about fasting, again, it's similar with Shabbat. They're not thinking about Mechalel Shabbat. They're not thinking about the Isser of eating on Yom Kippur. They're not in that frame. You're asking them, should a person fast? No, they shouldn't fast.
Because they don't know the alternative.
What?
Because they don't know the alternative. Because if you're fasting, still eat after the you can still eat after the
right.
Still eat after the
Yeah, but the katav is only for someone. That's only for someone who needs it. That's why you don't do that.
This is the case. If your little needs it, you tell her, yeah, you can eat up to and you still fasting.
Right, but we don't tell people to do that unless they're in a danger zone themselves.
That is danger zone.
So the thing is, we're trying to say, Yachin is saying that's not true. Most pregnant women are not in danger zone. Be'emet, I can tell you, I've seen women who are already in the 9th month and they fasted on Yom Kippur without a problem. Yeah. A lot of times, I'll tell you the truth is, a lot of times it's up here. It's up over here. They hear a story about some girl somewhere who was pregnant and fasting Yom Kippur and this and that. So now in their head already, they're playing out that they can't fast. Before the fast started, they already cannot fast in their head, right? I've had these phone calls all the time, come to me every Tisha B'Av, every Yom Kippur, people calling me over and over again. My wife is pregnant. I don't know if she can fast. I keep telling them she can fast. She can fast. And if she can't fast, I'll tell you what to do. But she can fast. One time I was talking to this guy, his wife takes the vote. She says, but I can't fast. I said, of course you can fast. You just have to try it. I said, I've seen many people do it. Okay? Healthy women. I know them to be healthy. I didn't hear that they were not now. They come and you tell me they have problems and stuff. 25 hours without eating, as long as you're not going crazy and stuff like that, everyone can handle it. It's not gonna most Ruba to Ruba from what I've seen and spoken to Jewish doctors is not an issue. They have some pregnancy complications or themselves of a weak constitution and stuff like that. That's a different story. All right.
Or after they just deliver.
After they deliver their butter in the fast. That's on Tisha B'Av and stuff. We're talking about being pregnant with child. Okay. Anyway, moving on. Now we're going to come to the other source. What about a Jewish doctor, but he's not religious? Okay. So sometimes non-religious doctors can be a little worse than non-Jewish doctors. Yeah. So you have some right? So when you have anti-Jewish people who are anti-Jewish, they're worse than anti-Jewish Deutsche people. It's just the way the world works. Anti-Jewish people are a lot more trouble than anti-Jewish non-Jewish people. So this question was brought to Rav Elyashiv. Rav Zilberstein brings it down that he brings from Elyashiv that the doctor who is not shomer Torah mitzvot choshed la'avor al divrei Torah omer sheyesh chashash sekana. Rav Elyashiv says chayavim lishmor lo. You have to listen to him. So even if the non-religious doctor says you can't, you have to eat on Yom Kippur, you have to listen. Why? It's a doctor's opinion. As long no one is arguing with him. And then he writes, and the Bir Halacha tells us, you should go to a religious observant doctor to ask these type of questions. It's for twofold. Number one, the religious doctor, he's going to have in mind, he knows the halachot. He knows what to think about, and he knows how to apply the situation to this situation. The guy or the non-religious person, he's not really in that situation. He might be against them, whatever it is, you don't know, right? Religious observant doctor who is in the situation, who knows the halachot, knows how to apply them, that's the guy you want to go and ask these type of questions. Quickly look in the Tzurba, in the Rabbi Nachson Chayol Amim. He writes as follows. One may rely on the assessment of a non-Jewish or non-observant Jewish doctor that the patient is in a life-threatening situation in order to permit performing Melacha on Shabbat for the need of a patient. So when it comes to Shabbat, I want to make this little distinction between eating on Yom Kippur, asking these doctors, versus being Mechalel Shabbat based on these doctors, non-Jewish or non-observant, because it's a little bit of a difference. Eating on Yom Kippur, you're proactively saying they have to eat, versus here you're saying on Shabbat, the guy is in danger. So you listen to them. Non-observant, non-Jewish, you're going to listen to them. For Shabbat. If you think it's B'kuach Nefesh, you have to listen to them. Safek Nefeshot Lahakel. Okay? If a regular person who's not a doctor claims that another person's illness is life-threatening, one should listen to him. Mechalel Shabbat. However, if possible, okay, we're going to get into that. Fine. We'll leave it over there. Let's move on to the next piece. Okay. Says the Bir Halacha. Remember how before we said we can listen to the patient? Patient says, I have to eat. Patient says, I'm life-threatening. You listen to him. Says the Bir Halacha, this is not always. If we know about his sickness, source 15 in the bold, the Bir Halacha, and the sick person says that a certain medicine, trufa zo mo'elis l'machal hazu, v'areifa omer she'enem oil b'zeh, ein svar l'shmoil l'choil l'chal Shabbos b'chim. You hear this?
Well, this.
And what? You're saying it. Say it better.
I'm not saying anything, because at the end of the day, you can kind of do both ways. But I would assume that the guy who says I need it was the doctor as opposed to the guy himself.
The Bir Halacha says you don't listen to the person. The Bir Halacha is making a distinction. The guy says I'm in danger, you listen to him. The guy says do this therapy for me, you don't listen to him if he's arguing with the doctor. Because in the end of the day, we're saying the doctor knows which medicine and which therapy is better for this guy. I've seen it, Russian patients. We'll pick on Russian patients for a moment. Russian patients, no matter what they have, they want antibiotics. You tell them you don't have a bacterial virus. You don't have you have a virus. You don't have an infection. No, I need antibiotics. Now give me, you're not good doctor, you don't give me antibiotics. That's the way they are. Right? So that's what the Bir Halacha is saying. The guy says, I want this medicine. You don't know this medicine is good for you or not. The doctor's been trained to know what they are. The pharmacist knows. So if he says, I'm in danger, you trust him. He knows his body. Not sure. He knows when he's in danger. But if he's saying, do this for me, that the Bir Halacha says you don't have to listen to him. In fact, the Radvaz, the Rishon, already brings this on page 282 in source 16. Says the Radvaz. He says that if the doctor says that the medicine that the patient is asking is not good for him, shomim l'rofeh v'afilu b'chol. We listen to the doctor even during the week. Patient saying, give me this medicine, give me that medicine. The doctor says, that's not for you, that's not good for you. You don't listen to the patient, you listen to the doctor. He has more expertise. And he knows what is better for this fellow. Okay, so again, this could go back to the Gemara that we saw. The Gemara that we saw. The Gemara said that when the man has confusion, he says, I can fast. We say, no, he can't fast. The doctor says he can't fast. Confusion fell upon him, so we don't listen to him. So we can possibly say this over here as well. The guy's saying, give me this medicine. We're not going to listen to him because, first, he doesn't know. He's not an expert. Maybe he's confused. We're going to listen to the doctor when it comes to the therapy. Now, we're not saying you can't ask for a second opinion. Right, from another doctor. We already saw that. You can have expert doctors arguing, or multiple doctors arguing. But the person himself, a lay person who doesn't know medicine, and he comes in and demands, I want this, I want that, I don't want this, I don't want that, they have no idea what they're talking about. And I, as a person who's working in a hospital for over a dozen years, have seen the ridiculousness of certain people who come in and say, we want this, we don't want that, we want this. So I've had times I have to tell them, you're always free to leave. Doors are open. You can sign against medical advice and leave, because at some point, either you're going to trust what we have to tell you or you're not. And if you're going to keep telling me about NYU, you're more than welcome to go to NYU.
That reminds me of a joke.
Go ahead.
So the nurse pushing the patient, please, nurse, maybe second opinion, this and that. Says, no, doctor said more than more.
Did you hear the joke about Keel? The joke was
Doctor said more.
the transport picked up the patient and was going to the morgue. So the patient says, I need a second opinion. I don't think I should go to the morgue. He says, no, the doctor said morgue. That's it. We're going there. So obviously, second opinions are okay. And the person has a concern is okay. But at the time that you start demanding this over that versus multiple doctors already talking about it, then we're having a different, and that's what you see in the Radvaz, and you see from the Bir Alocha as well. Okay. So the Minhaj Shlomo, Rabbi Shlomo Zalman Auerbach, deals. It's a very good story, by the way. I want to say it at work tomorrow. So, Rabbi Shlomo Zalman Auerbach, he wants to know, what do you define pekuach nefesh? Like, the guy just ate cholent, a whole bowl of it, and now his chest is hurting. Right? Is it heartburn or is it a heart attack? What's this? I don't know. Right? Should I run? It's hurting now. Should I run? It could be something dangerous. Right?
Is his left hand numbing?
So if someone says pekuach nefesh can be judged by the way most people react to the situation. Like if I just ate a bowl of cholent and I'm getting heartburn or something hurting over here, I'm not going to think it's a heart attack. I'm going to think it's a heartburn, and I'll take Tums or I'll take something else, whatever it is, to try to alleviate. Eat almonds or whatever it is to try to alleviate the. I won't think it's a heart attack and say, oh, it's pekuach nefesh, and I got to run to the hospital. Right? So let's take a look. He says, near Linia's daiti. The kol shederch roiv b'nei adam livroich mizeh, kivroich mipnei asakana. If something that most people flee away from, the person gets scared in such a situation, we can say this is pekuach nefesh. But if people are not, okay. Yeah. So now Rav Shlomo Zalman talks about what about vaccination? Okay, it's vaccination in this sense. Smallpox is out there. Okay. So now they say, come on Shabbat to get the vaccine for smallpox.
Why can you do it before and after?
That's the appointment they gave you. On Shabbat, come for smallpox vaccine. Can a person go or not? He says, if you can take it before or after. Why? Because no one's that scared that this moment you're going to get smallpox. People wait. People get a little early. People get a little later. Yeah. It's not considered sakana pekuach nefesh, sakana nefashot, in order to go on Mechal Shabbat. But says Rav Shlomo Zalman Auerbach, if you're going to miss your Saturday appointment, the next appointment the government's going to give you is in 5 years from now. Then you can Mechal Shabbat and go and get that vaccine. That's what he writes over here. Right in the last paragraph, he writes, he's not going to get it. You have to wait since it's going to be his man meruba, and this is going to be a scary situation. What? Whatever the Chil Shabbos may be. If it included, whatever it includes, it's given in one government office somewhere, and you can't say whatever the story is. The idea behind it is important. The idea behind it is that you're true pekuach nefesh because it's not going to happen this moment. That's one thing. But if in order to prevent it, it's going to take you a very long time, then that is considered pekuach nefesh. That's what Shlomo Zalman Auerbach is picking up. Now, we only have a few minutes to go through some of the examples. I don't want to rush through them because they're all very important. So if we have to split the share into 3, that's what we'll do. So let's take a look at the first example of what's pekuach nefesh. So now we're jumping out of Masechet Yomah, and we're going to go into Masechet Avodah Zarah. Again, none of this is found in Masechet Shabbat. So we're on source number 18. Source number 18. And says the Gemara and Chavchat Aleph. Okay. Give me 1 second. Here we are. Fine. The Omar Rav Ada Bar Matna Omar Rav. Gav Hayad, the Gav Haregel. If he has an injury on the top of his hand or the top of his foot, Harehen Kimaka Shel Halal. It's an injury of an internal injury. Internal injuries inside the body, in the cavity of the body, is a very dangerous injury. Person has shown the appendix erupt or liver.
What do they call bad?
The hand, top of the hand. I'm not sure. Probably here. Is it the top? Right? Is this the top? That the top? Fine. End of the day. Oh, on the top, yeah. Yeah, usually you get veins up here. Okay. It's considered like an internal injury. You mahalel Shabbat for it. Now, what's considered inside? Mehechan Makah. Did I skip one? Omer Rav Shema, yeah. Omer Rav Shema bar Abba, Omer Rav Yochanan. Vaha ishta semirta kimaka shel halal. The fever. Fever is considered like an internal injury. It could be mehalel Shabbat. What fever? What's the temperature? We'll have to see Rav Moshe and pretty much everyone else when we get there. The next case, we said internal injuries. Mehechan makesha halal. Where is it? What is it from? Where is it considered internal? Pirash Rabbi Ami min hasafa v'lifnim. From the lips inward. From the lips inward. So very Belazar. What about my gums and my teeth? Are the gums and the teeth considered inward? And if I have a problem with my teeth, I have a toothache, like give me halal Shabbat or not? Or is it considered too external? Is it because it's hard? It's considered an external infliction, like a scratch? Or dilma, since it's inside the mouth, and it's considered pekuach nefesh. Which one is it? So we'll start with internal wounds. Says the Shulchan Aruch, kol makesha halal da'inu mishenayim v'lifnim. Mishenayim etzmam bichlal. Teeth are included. Mechalin alein et hashabbat. How much so? So just to bring it out from the Rabbi Naxon, he says, one who's having an intense toothache on Shabbat and needs to have the tooth extracted may have the tooth removed by a non-Jewish dentist. However, if one's experiencing intense pain and is not being solved by taking painkillers, such as if he has an abscess, a pus-filled infection that causes severe swelling, that is considered a pekuach nefesh, and even a Jewish doctor can deal with that, and one should be mechalel Shabbat in order to take care of that person. So if the tooth or the gum is infected, mechalel Shabbat. Toothache, the Jew cannot mechalel Shabbat for that. That's what the halakha differentiates. But so when the Shulchan Aruch is saying the tooth is included, we're saying that means it's an infected tooth or the infected gum. That's mechalel. That because infection can leave life-threatening.
So regular wounds as well. Stage 4, stage 3 wounds.
Wounds that can get
becomes
infected,
internal.
That's correct. Can be considered. It can be halal Shabbat. We're going to see that. We're going to see that in a minute. That's correct. Talking about stage 3, stage 4. We're talking about pressure ulcers. Those are wounds that if a person in the bed doesn't move or he's moved incorrectly, they sit in the bed too long, their skin starts to deteriorate and they get holes in their body. These are called pressure ulcers. You have to turn and position them to prevent it. So what happens is it opens up. When it opens up, if you don't treat it correctly, it can get infected. If you get infected, it can become life-threatening. You can get sepsis. Person can die from that. That would be a case. You can be halal Shabbat for that. It's an internal wound, goes inside. Well, it's internal. I don't know if it's internal means inside the cavity, but this is it's an affected place. We'll see. We'll take a look at that in a minute. So we'll stop over here, and let's look at the Ran. The Ran says internal means an abscess, an infection, a wound, but aches. No, that's what we said. The toothache is not, but an infected tooth is considered pekuach nefesh. We have a lot more to go through. This is a very important halachot, of practical halachot, because unfortunately people get sick. that Hashem is zochet to continue next week on the next part.